As the temperatures drop and people start to travel for the holidays, sickness, we know this time of the year, begins to spread. Megan Hartnett joins us live in studio. So Megan, what are doctors seeing as far as what's going around right now?
Jeff, the doctors I spoke with say people are coming in mainly with sinus infections. There has not been a huge increase in the number of patients with COVID and the flu, but that could change. As people get ready to gather around the table for Thanksgiving, they might also have to gather the tissues and cough medicine.
I think it's mostly because the season's changing. We've gotten more rain. It's colder out.
Something doctors say people don't always handle well, leading to different illnesses starting to spread around the table. Doctors from ProMedica and Mercy Health say people should get ahead of whatever they may encounter.
The most important things are getting vaccinated, washing your hands, and when you're in situations, especially if you're at high risk, we would recommend masking.
We do not hydrate well enough. And so when that happens, and when we're not getting enough sleep and movement, we tend to have increased stressors on our body, and weather change is a big stress.
If someone does start to come down with something, there are a few symptoms people should take seriously and potentially go to the emergency room for.
The big, bad, ugly stuff, short of breath, high fever, above, 102, 103, that's not responding to Tylenol or Motrin.
There are some other symptoms people should watch out for, including having trouble hearing. When people get sinus infections, there can be a buildup of fluid behind the eardrum, but this should eventually drain as congestion decreases. If symptoms continue to persist, people should monitor them and use their judgment to know when to see a doctor.
When in doubt, get checked out.
Doctors say people will experience different symptoms based on the different strains or even based on how their body reacts to certain illnesses. Not everyone may have trouble hearing or a really bad cough, but no matter what, it's important to try and get ahead of any symptoms. Reporting in studio, Megan Hartnett, WTOL 11.